A very common call to a pediatrician, my little one is staring, not functioning, and blacks out. And they go to the emergency room, and the doctor in the emergency room said, oh, it's probably concussion. What's a concussion? Does that lead to anything bad down the road?
Well, a concussion means you hit your head and you passed out or had a change in level of consciousness for a period of time. A single concussion in and of itself is not worrisome. It does not hurt the child, has no long-term repercussions, and in fact, even though scans are obtained of the brain very often in emergency rooms nowadays, there's absolutely it's not clear that one has to do that in a child that looks normal after they get to the emergency room. It's not usually associated with any problem in the brain, and it's not usually associated with any long-term problems. In an older child, though, we know if you get a concussion, it's probably not good to get a second one very soon thereafter, and a second one might be more serious and indeed even could be life-threatening. So we encourage people to get a concussion to try not to hit their heads for a while after the first event.
So that's why the American Academy is adamantly against boxing?
Well, that's a good question. That would be one reason you could be against boxing. Another reason you could be against boxing is you can get something called, a fancy term, pugilistic dementia. And pugilistic dementia is a long term, but what it means is you lose your intellectual functioning because you get hit too many times. And what happens in that situation, you actually get little strokes in the brain. So if you box a lot, you are going to get little strokes in the brain for sure over time if you do it long enough and you hit your head enough times. That's different than concussion. Concussion doesn't have little strokes. It's just that you hit your head, you lose consciousness, and you become normal thereafter. But if you do it again shortly thereafter, the first time, it can be very serious with brain swelling.
If the child had a concussion but was vomiting afterwards and lethargic, that kid, there's no question, needs a neurological evaluation.
Yes. And I think in general, anybody that has a concussion should probably go to the emergency room. In general, we do that. You don't always have to, but they can be seen by the pediatrician, certainly, but should be seen by somebody. If a child, though, calls up the pediatrician and says, my child hit her head and she dazed off and now is vomiting and has a headache and is not normal, that child should be seen and have brain imaging right away. Should probably not go to the pediatrician, bypass the pediatrician, and go to the emergency room.
But they seem to do CAT scans and not MRI. Why is that?
Well, CAT scans are a different test. CAT scans are an X-ray. MRI uses radio waves and magnets to take pictures. The reason CAT scans are used more in emergency rooms than MRIs are really threefold. One is CAT scans are more available everywhere. Two, CAT scans are faster. We can do almost all children without sedation with a CAT scan, where an MRI almost always needs sedation, which is a problem in a 3-year-old that's had head trauma. You don't really want to do that. And three, CAT scans are probably better for looking at changes related to trauma, such as blood, in the acute situation. So CAT scans are typically done in the acute situation.
You heard someone had a head injury and they had to go to a neurosurgeon because he had bleeding someplace in his head. Why is that?
Well, if a child, like the example that we talked about, a child is still vomiting and has a headache after head trauma, the concern is that there's bleeding inside the skull. And that can happen. And if there is bleeding inside the skull, if it's substantial, causing neurological problems, we sometimes will have that drained. And that can be life-saving. And also, if depending where it is and how fast it's obtained, have great results with no long-term consequences to the child.
Thank you, Dr. Pavlakis.